unlike a birth control pill, which is a significantly higher dose. So has anybody ever been told that birth control causes blood clots? Okay, some of you. That's very impressive, actually. Most people have not been told that as part of the risk factors of birth control, but it does. So it gets metabolized by the liver. So this study is looked at conjugated equine estrogen alone. So it slightly increased your risk of DVTs and pulmonary embolism, which are blood clots, decreased your risk of stroke, decreased risk of breast cancer. Do you see this? This is from the WHI study. So decreased risk of breast cancer, decreased risk of all-cause mortality, decreased risk of all cancer deaths, decreased colorectal cancer, decreased all fractures, decreased diabetes. Does that sound like it increases your risk of breast cancer? No, right? And then, so where does that even come from, that estrogen increases your risk of breast cancer? So in the arm that looked at estrogen and progestogen, which is a synthetic progesterone that we don't use today, the study showed that there's a slight increased risk of breast cancer. However, the control group of the study had previously been exposed to estrogen. What do we know about estrogen? It decreases your risk of breast cancer. And so if your control group in the study was previously exposed to estrogen, and so their risk of breast cancer is decreased, and you're measuring it on that, then I guess that makes sense. Now, when we actually look at what was the actual increased risk, the actual increased risk was not very much. Let's look at the next slide. So for 1,000 patient years in the control group, there were 3 cases of breast cancer. In 1,000 patient years in the actual study arm, so this is the synthetic progestogen, there were 4 cases of breast cancer.